just going to be a little bit tight, OK?
OK.
Louise Smith has been asked to get a blood test.
OK, sharp scratch.
Her doctors are worried about a family history of diabetes.
Since Louise Smith, please go.
Hi Louise, come in, have a seat.
The Health Secretary wants patients like Louise to never wait more than 2 weeks for a GP appointment. And if they're really sick, be seen on the day.
I think for minor, illnesses, it's 2 weeks I think is fair. Urgent is, I think it should be dealt with straight away. I mean, when I've had urgent cases, I would actually just go to A&E.
Thérèse Coffey says she'll help primary care with more nurses, support staff and better telephone systems. But doctors like Ravi Tomar say that alone won't help a health service on its knees.
All statistics, all research, all the actual data suggests that general practice very much is on the back foot, on its knees, at breaking point. Not to say there's not easy things and quick wins that we can do to help that, and in long-term things that we can do to try and address that as well.
One doctors group warns the healthcare crisis is so bad, 1 in 4 people could be left without a GP within a decade. GPs agree patient access must be made an urgent priority. But what they don't want to see are more targets without being given the help they need to manage growing patient registers and GP practices hemorrhaging doctors.
Come on.
Problems accessing the right care at the right time stretch well beyond general practice. Jenny Morgan is still in agony after a missed fracture and delays to her treatment.
They ruined my life. I was able to do things. I was able to do the garden, do the shopping, look after the house. I can't do any of that now. And I'd love to do the garden and, instead of pay somebody to do it, I'd love to walk the dogs. Somebody else has to do all these things.
Hello.
So, welcome to...
And it's patients like Jenny that the Health Secretary wants better care for. She rejects criticism that her plans fail to address the workforce issues that are driving NHS pressures.
I'm standing up here for patients, focused on my ABCD, because that's what most people experience, getting access to a doctor, getting access to a dentist, having an ambulance turn up on time rather than be stuck in terms of being stuck outside a hospital. Those are the things that matter when people need care the most, and that's what I'll keep my focus on.
The Health Secretary and healthcare leaders want the same thing, better care for patients. The challenge is to find the best way to deliver that care in a system under pressure like never before. Ashish Joshi, Sky News.